I want to show you a case example, though, of a very common scenario that I see in my practice. Scoliosis and spinal deformity is my concentration, and a lot of times patients that have this problem are older, in their 70s, if not early 80s. So screening for osteoporosis in these type of people is a absolute must. There is nobody that should undergo scoliosis surgery without first being screened for osteoporosis. No adult, I should say. Here's an example right here of a patient that we had a bit of a predicament. This was a woman that came to me, 78 years old. She had a lot of pain from her ribs. This is the right side, that's the left side. From her ribs actually resting on her pelvis. So when people get their ribs resting on their pelvis, that a lot of times is a point of no return. That is a very difficult pain to treat. Not only that, she was also having a harder and harder time standing upright. You can see how positively curved her spine is. Looking at it, she probably had a little bit of a curve as an adolescent, but over time, as the spine degenerated, this curve got worse and worse. And her osteoporosis did not help the problem. You can see that some of these bones in here are misshapen, or you can take my word for it. They're like cardboard boxes that have collapsed more on the one side than the other. So because those bones have collapsed, second to her osteoporosis, that has also worsened her scoliosis, has worsened the amount of pain she has, and has made it harder and harder for her to stand upright. For a woman like this, who you can see as well when we look at her from the side, her head is starting to come forward as well, right? So this isn't just a problem from the frontal plane, meaning that S curvature. It's also a problem when we look at her from the side because she's starting to come forward. She had tried everything that wasn't surgery, right? She had tried nerve blocks, she had tried braces, she had tried physical therapy, pain medication, nothing was working. So at that point, surgery was really her last resort. It was her last option. We did a osteoporosis screening with a QCT. We found that she did indeed have osteoporosis. And then what we did was we had her treated with a medication for 3 months before surgery. So we had her see one of our bone specialists, one of our endocrinologists, who put her on a type of medication to actually build the bones. And there's different medications to treat osteoporosis. Some are done just to stop the osteoporosis from getting worse, and some medications actually help the bones build back up, make them stronger. Whenever we're thinking about a long spinal fusion, so a deformity type of correction, most of the time we like patients to be on one of these bone building drugs before getting this type of surgery. We put her on one of those for about 3 months, and then we did the surgery. And thinking about her, there was sort of 2 ways we could have thought about this. One way is we could address the primary problem alone, which is the curve at the very bottom of her spine, right? That's really what was what we'd call the main curve. And this was what was driving the biggest part of her deformity. On the other hand, we could have just fused this bottom part. On the other hand, we could fuse from the bottom all the way up to the top to correct the whole spine. As well, this gives her more structural support than if we only did half the spine. Now, I would say that the majority of surgeons nowadays, or the majority of surgeons would address the entire spine, go from the, from basically the top of the shoulders down to the bottom. However, we took a bit of an unconventional approach for this woman. What we did was we actually addressed only the bottom half of the deformity. We did this because there was some stiffness in this region, and I thought that it was possible we could get away with fusing her halfway up the spine without needing to fuse her the whole way. We did a couple other things to mitigate, or should I say lessen, her chances of having a problem with the screws, because once we put these screws in, they have to hold. They have to hold. If they don't hold, they're going to come loose. The drug definitely helped somewhat with the screw purchase, we call it. The screws felt better than they would if we hadn't done the drug, but still, it doesn't feel like normal. So one thing that we actually did at the top of this woman's spine was we augmented the screws with bone cement. Now, this is a technique that's been around a while, and it sounds like it's a perfect thing. Okay, great, we'll just put bone cement in and that'll help the problem. However, there's other complications that can occur with bone cement, so it's something just like anything in surgery that you have to consider the risks and benefits. For her, we felt that the risks of the bone cement were worth the potential benefits. The other thing that we did with her is we really concentrated on making sure that she was balanced not completely straight. So you can see that when we look at her from the right, you can see that her head was off to the side. If I draw this line down, we can see how her head is way off to the right. So what we did is we corrected the curve not to make it completely straight, but enough to make her balanced so that her head is now centered over her pelvis. We knew that the screws were going to be weak, right, or weaker, and we knew that we couldn't use them to manipulate the spine in a very, very substantial degree to make her totally straight. So what we did was we manipulated the spine just enough so that the bones would hold still, that the screws would hold still without coming loose when we did our corrective maneuvers. So by kind of striking that balance, from top to bottom and from side to side, we hopefully gave her a good long-term result. Now, she's only about 6 months after surgery, meaning we are not out of the woods yet for her, right? She could still get problems above, the screws could come loose. Fusions take at least a year. But so far she's doing okay, she's doing very well actually so far. We still at some point we may need to extend her up, but right now this seems to be working.